What is good, guys? Mazen Alimi here, back at you today, 19th of February, Wednesday, lunchtime session. Just picking up Charlie.
What's
happening on the scene.
YouTubers.
And yeah, so today we are going to have a leg session. And we'll do a lot more knee stability work, isolation, single leg, and yeah, we'll just try and get some weight and just see how it feels, get the blood moving, and yeah, short but sweet because it's a lunchtime session, but yeah, we hope to get all kinds of angles in there.
Let's go.
And stuff like that. It's just absolutely destroyed me.
Yeah.
So today is going to be a huge session in the gym.
Yeah.
Mazen has ACL injury, T-Bag has left knee meniscal tear.
Left knee meniscal tear.
So we're going to do a small leg session.
We're going to do a very big leg session. We got Ironman to do, haven't we? We got Ironman to do, so it's go time. It's go time.
You know what you should get? You need to invest in the one that goes in your head. The cameras, no, they're wicked. I've seen so many videos where you don't have to touch nothing, it's just on your head.
Yeah.
And you're just there, like whatever you see.
Go on then, Charlie, you can go. Start recording.
Right, boys, what's happening?
Right, so I'm going to do a little cycle to warm up. Yeah, knee's feeling all right at the moment. You can see it's not really swelled up at all. The initial injury happened in November, so yeah, 2 months down the line, 3 months down the line, it's okay, and it's sort of feeling strong. But I think it's just warm it up, get it sort of nicely flowing, increase this up a bit.
Level 10, yeah?
Yeah. Why not?
Let's
Why
go.
not? And we go. Trust nobody. So leg press, calf raises. Right, so we got T-Bag over here, also half injured, as you can see. He's doing these leg maneuvering sections.
So currently, I've got left knee injury, but I was doing both. That exercise to activate the gluteus medius muscle to prevent further meniscal injuries and to help this one recover.
Nice. Right, so just wanted to give a little recap of today's session. Did 4 exercises focusing both on single leg and both leg. Legs are feeling good. Nothing really quite heavy, but just something quite minimal. 45 minutes, 50 minutes in, and then yeah, back to work. So just outside the scanner center. So hopefully today we'll have an operation date set in stone, and we'll let you know how it goes. Fingers crossed. Lovely.
Pop yourself on there.
Okay, so yeah, right.
So your left one, you had your hand pulled up your hamstrings for that one. Yeah.
Yes, hamstring graft.
And your range of movement, just to compare side with side, is good there. How much bend have you got? Yeah, got about it. Yeah, good. Fine. Let's get you comfortable. Sit forward for 2 seconds. Yeah, rest yourself back.
Okay.
Let's have a look. So how swollen was it? I know that's always.
Yeah, initially it was quite swollen. Yeah.
Ballooned up.
But yeah, I think ice
Your range of movement's pretty much come back.
It's not too bad in terms of movement.
And any particular pain at the minute in this knee?
Not much, but when I do exercise, there tends to be a bit of swelling afterwards.
Yeah.
And then also, I went to the gym today and there was a bit of pain, just slightly, so I just sort of eased off it.
Yeah. Oh, we nudged it. Yeah, so you have got a decent amount of play there, haven't you?
Yeah.
So your ACL has a couple of functions. One, it stops the anterior, what we call anterior tibial translation, so my ability to pull your shin bone forwards.
Yes.
And with an intact ACL, it would feel much more stable. So that test is called a Lachman's test. So I can certainly bring your tibia forwards.
Okay.
You've got that play. And then also what your ACL does is give you some rotational stability as well.
Okay.
And that's the relevance, because we've always realised for a long time that just because you've got an ACL deficient knee, some people can manage without an ACL. Okay, certainly
this is what I've heard. So
certainly straight line sports, you're running, swimming, cycling. There's people who have professional sporting careers with no ACL. In my practice, a torn ACL doesn't have to equal surgery.
Okay.
And this is why I tell you, even though you've had your other side done and a good result from that, you know, it doesn't have to be surgery. Okay. We know from your scan, from your examination, that the rest of the ligaments in your knee are stable. You haven't torn your cartilage. About a third of people that tear their ACL tear a cartilage as well. And sometimes that needs addressing independently of the ACL or the same surgery. So it is just, if you like, not to underplay it, an isolated ACL.
So, which is good.
It is. So
there's
nothing else to rush to do.
Okay.
So our options are every option. One, we don't go down the surgical route at this stage. We physio you. We continue to build your quads back up. We recruit what are called secondary stabilizers around the knee. That will compensate, if you like, for the ACL deficiency. And we see on how you go. And I've got a number of patients I do that with, and even test them to failure. Say, right, what do you want to go back doing? If it's football, let's rehab you, go and play football. And your knee will tell us one way or the other whether the minute you step on the pitch and you run, you think, this isn't right, or you can manage to play, but you start your pivoting activities, the twisting, turning, then the knee lets you down and you struggle. That's one option. The other option is we try that period of conservative, but a bit more defined, and saying, right, let's aim to get you back doing everything by 2 months, and if you're not back at that stage, let's get on and reconstruct you because of the rehab process afterwards. And third option, we say, fine, you've had a good result on one side, you're ACL deficient on this side, you've had one side reconstructed, should we just get on and reconstruct this one? And what I tell people about reconstructions, there's the practicalities and there's the risks. Practicalities, the first couple of weeks you can be a bit sore, knees a bit swollen, your quads particularly, or your hamstrings that I would steal as the graft, can feel like a deep muscle pull or can slip and feel like you've pulled a muscle there. It's a couple of weeks on crutches, it's about 6 weeks of not driving, particularly with being your right leg this time. About 3 months before you're back running. 6 months of intensive rehab, and then after that is then the sport specific rehab to get you back doing the certain activities that you want to do. Risks, tiny risk of bleeding, infection and blood clots. Re-rupture, we all quote about 90% success rate, with 10% re-rupturing, either something technical, tunnel placement or graft size, or a patient not doing the rehab or having a re-injury, or a slip or a twist or something. There are a fair number of patients out there like yourself who've torn both ACLs. So what reconstruction is obviously doing is giving you a stable knee, but are we reversing any particular predisposing factors for why you ruptured your ACLs? We're not. So given the right amount of force or mechanism, there's a chance that you may re-rupture your graft on either side, if you went down a reconstruction. There's the risk factors for rupturing ACLs depend on your alignment, depend on how you sort of weight bear through the knee, how you
land, how you twist and pivot. Certainly in the adolescent population, there's a big push towards ACL prevention. Look at how kids playing netball, football, that sort of thing, how they land, you know, rather than the knees dropping and stopping that big rotational force. Ultimately, at the end of the day, as corny as it sounds, it's your knee. You know what you know what your left one was like. They never quite ever behaved entirely the same.
Yeah, no, that's true. So for me, I'd like to be playing sport to a high level. Before I injured it, I was playing 3 times a week, 4 times a week football. I don't know. I just feel if I left it and without a cruciate there, just to stabilize everything, that might be playing on my mind.
I think that's one of the biggest underplayed issues around ACLs. Okay, and even in terms of getting people back playing sport after, that giving them the confidence to go back when they want to avoid that re-injury and that horrible feeling that they had when they had their initial injury. I think that's one of the biggest things that stop people going back. And if you look even in your success group, it's probably around 60-65% of people that go back doing what they were doing before they did it to what they do after their reconstruction, with confidence, I think, being a massive part, as well as throwing the time difference or the time lag of diagnosis, treatment, physio afterwards. Lots can change in people's lives, families, jobs change. A lot of people reflect and think, okay, I'll not football on the head or whatever. So multifactorial why people don't go back, but confidence certainly. But equally confidence knowing that the knee wasn't quite right. If your knee is ACL deficient and unstable, the worry is you're not loading the knee properly. You might have a further episode of instability. If you were then to have a significant cartilage tear and ended up with some of your cartilage in the bin, that's arguably more destructive than being ACL deficient, because you're losing the shock absorbing capacity of the cartilage, and the bones can just bash together. So I need to move some stuff around and jiggle things up, because I totally agree. Your knee is settled. So the important thing is with your knee, your range of movement's full. Your knee is quiet, it's not still full of blood, so it's important, so it's an appropriate knee now to get on and do. So we need to find some room over the next few weeks. And get it done.
So I know you have to do your sort of thing, but the sooner rather than later
absolutely.
for me. In the meantime, I've got a physio appointment tomorrow, so she is going to sort of give me some pre-op.
Prehab, exactly.
But I've let my work know that I could be on crutches for a set amount of time. I didn't know how long I would have been out for driving wise, because I travel across the country driving, so that might be quite difficult, but a lot of the time I can just make sort of phone calls, and the sooner that I'm back to full fitness, I think the better for everyone.
So with it being your right knee, there's various issues regarding driving. One is your ability to be safe. To do an emergency stop, etc., and do something that's not going to damage the graft, and be enough that if you were to drive into me, that my insurance company would go, oh, he's just had an ACL reconstruction, it's his fault. I would recommend at least 4 weeks of not driving, with it being your right side.
And this is what I'd sort of planned into my time as well.
Because of the discomfort as well, and if you sat in a car for length of time, your knee will stiffen. So, right ACL reconstruction, we're doing it to stabilise your knee. Risk, as we mentioned, small risk of bleeding, infection, blood clots, and that does say re-rupture, so that's awful handwriting. I've signed it here. The rest of the consent form says you know what we're going to do. I'm not going to do anything else unless it's life or limb threatening, which it won't be. The anaesthetist will come and have a chat to you about what they will do. Depending on what time of day we do it, we may well be able to do this as a day case in and out the same day. Sometimes my lists run till 9 o'clock in the evening, and thus I don't like sending ACLs home, even if they're really comfortable that late, because if your local anaesthetic wears off, your pain relief wears off, and you wake up in the middle of the night screaming in agony, then I think that can well affect how you do afterwards. So if that was the case, I'd far rather keep you overnight, get you home first thing in the morning. When you're nice and comfortable. As long as you're a happy fella, I just need a signature there and print beneath.
And there we have it. I think that has been confirmed that ACL reconstruction is required. sad to hear, but we knew that was going to be the outcome. We had the MRI and things, so yeah, it's good that we can get things progressing and moving on. And we just come out with a positive attitude. This is the second ACL which I've had, and it could hamper me in the future, but I think if we keep the physio, the rehab and in everything to the best that it can be, I'm sure that it's going to be fine. And yeah, we're going to do some big things this year, big things. So yeah, onto the operation. I think it's time to go.